let's go ahead and go over the change of shift first, and then we'll go over the client rights, okay?
How long is tutoring?
1 hour,
Okay.
so we'll be done at
I
2:30.
have a quick question, like for a minor that's married, would he be able to sign for himself?
Yeah.
Yes, because he's legally emancipated at that point.
Oh, when you get married, that counts.
You have to
as
get emancipated.
emancipation?
But usually you would get emancipated to be.
Oh, they're still separate.
Yeah, but usually they're emancipated if they are married as minors. In most states, they're already separate from the parents. If that makes sense.
Also, when there's an emergency, does the surgeon have the right to consent if he's not able to consent, if the parents are not able to be?
In an emergency situation, yes.
Okay.
Is that thing where it was like invoking informed consent?
Right, because
Yeah.
of the fact that so if someone just comes in, right, like for example, somebody crashes,
Like the ER.
yeah, they just crash.
It's like a
Ambulance
minor.
packs them up and they go in, you will have life-saving measures, does that make sense?
Yeah.
Mhm.
Like, there is no question about it.
Mhm.
They're not gonna just sit around like, I hope somebody picks up the phone, like obviously at every point, they're gonna take life-saving measures if their patient's unconscious.
Minor or adult?
Minor or adult, yeah, they will go and take it, but if it's not emergent, or they just want a procedure and it is life-saving, so the other thing is, as well, if the answer's on there, I think what they need to do is also they call or they contact, I think, like a judge.
Yeah,
Yeah,
the
I had one.
Yeah,
It says only the judge can give order.
yeah, I would actually choose that one, so I think the surgeon will probably call the judge and then they get it, usually they already begin it, like, I guess you gotta separate real life from what NCLEX wants you to do, make sense?
Mhm.
So when it comes to NCLEX, call the judge. They have to issue the order. Make sense?
Yes, sir.
Yeah.
What's the right answer on the NCLEX then?
So that, call it the judge, you have to get the order from the judge. Yeah, I know, because that's what I'm saying, because I suppose how it would go, again, I've never seen that happen, but I suppose it should be quick. You're not gonna be on the phone waiting for the court to pick up. They have their own process where it goes by fast and they just kick in.
Mhm.
There was also a question on the test today about like, if a patient didn't wanna go through with the surgery, would you call the surgeon to come down and explain it, or would you just give them a written brochure of what?
No, you call the surgeon. If they don't wanna go through with the surgery,
I thought that
or
was
they-
If they had questions about the surgery.
or they have questions about surgery, only the surgeon can answer it.
Right.
There is no alternative.
Because we don't
Yes.
reinforce teaching
Yeah.
for that,
No.
right? No.
Because there was also a question where it was like the patient didn't want to do treatment anymore, and then it was supposed to be like respect the wishes of.
Then in that case, yes. There's a difference between, I don't know what's happening, I need my questions answered, then call the surgeon.
Mhm.
I don't want to do it, right? Like if they just refuse even though they know,
Mhm.
then you respect their wishes.
But if they already did a informed consent, you don't need the surgeon to do it, you could explain the procedure to them.
You still get the surgeon to come explain it.
Really? Because on one of the ECI questions, it says it on there, like, if they already signed
They
it,
already signed it, you can reinforce it?
reinforce it.
I would double check on that, to be
It
honest.
says you could reinforce it because they already signed it, they already know, they just forgot about what was gonna happen.
And you would just explain like the
You would just
general
explain
concept
it
of
further out.
I'll double check on
Okay.
that, yeah.
Well, I think that was one of them still on there, I'm not too sure, I don't remember. I never read
Alright,
the
so I
question.
can't find the change of shift report on here, so I'll just go over it with you. So the thing that you're gonna go ahead and change the shift report, routine care, so any routine medication, anything that's routinely done, does not have to be included.
Does not.
Does not have to be included. Even if they're medication or narcotics or anything like that, if they're routine, you're not including it. What you do include is any PRN meds. Because there was a change, right, that happened that they needed as needed medication. Yes.
So for that one was the pain do you think it was the pain medication? Because I think the answer that I chose was like, the patient's pain medication was given 2 out of 4 times during the shift or
Two
something.
times that day. or
So
something
could,
like
that would be PRN.
Yes,
right?
because there's usually a PRN.
What about specialized equipment?
For the same thing, like, would you include it?
Yeah,
And that's all it says, specialized equipment?
Yeah, that's all it said.
cause I chose
That was one of the answers.
Here,
I
Cause
chose
know
the,
that they wanted
I
I
that
chose
chose the
the pain
medication
yeah.
2 times. The pain
Oh,
medication.
so it's one or the other? It's the
Yeah,
medication.
it says pain medication. to
No, it's the
transport
pain
it.
medication because you're doing the as needed.
Okay.
Yeah,
Yeah, cause they only gave it 2 of the available 4 times.
right. So it's a change out of their normal routine. So any change in their medication, either they did not take it or they need it as needed, so their medication got changed basically, you need to endorse it. Any new orders, doesn't matter what the order is for, any new orders that were given on your shift, you have to endorse it, because nobody else knows about it now, only you do. Make sense?
Mhm.
So until the order's been standing for a couple of days, no one knows about it, it's just as you're endorsing it. So new orders have to be given, change of condition, which that is for anything, right? An altered level of consciousness, patients began throwing up, had an episode of this, right? Any clinical change of condition has to be endorsed. Anything medication out of the routine, so either did not take the routine or now taken as needed, the PRN, has to be reported as well. Any like restraints would have to be reported as well. Any incidents, you would go ahead and let them know during the change of shift report. Those are the most common that I'll see, and medication is probably the most common that you'll endorse, like the change in it. Hello? Make sense? Alright, now, let's go ahead and just cover the professional responsibilities, because that covers client rights as well as the informed consent, advance directive, all of that. So let's just go ahead and go through that. So client rights, right? Refusal of treatment, it can be done at any point. Even if the informed consent has been signed, they can still refuse, even if they change their mind later. Make sense? So they can always still choose, okay? You do have to have them sign something that they understand the risks and benefits of receiving or not receiving the procedure. That comes with it as well. So they can deny it, but you would just have them sign something if they also deny it. Now, I've seen questions where they're like, what happens if, they just left? Or, right, they didn't sign anything, they just left. Then you just document that, right? Patient left without signing, XYZ, that's what happened.
It's
Make
just
sense?
signing the NA, right?
Yeah. So they can not sign it, some people just leave, then you just chart it. You just document that they left without signing, okay? Yeah, so in short, that's what it was for. Now, advocacy. Advocacy for the, I know like it seems like we always talk about it, but just to clear it up, so that means that you're standing up for the patient. Make sense? Even if it goes against the patient's family or the doctors or whoever, right? That's client advocacy. It's you're doing what's best for the client and what's in their best interest. So that's what advocacy is. So forms of that are, right, that the doctor explains something and, they don't wanna go through with it, but they're being coerced, and they, you stand up for the client. Family wants to do something even though they're unconscious, but they had already said, this is what I want. Stand up for the patient's wishes, yes.
So for that question, the answer that I put was like, if your patient says, I'm gonna go through the chemotherapy because my family wants me to, that's the right answer, right? Because it shouldn't be because the family. But,
Right.
like, what do you say to that? Like, what do you tell your patient, like, you shouldn't do it because of
No,
the
it's,
family?
you ask, what do you want?
Mm.
But there was another answer, like he didn't wanna go through it because of something, I don't know, I think I picked that one, ask the doctor
Yeah,
or
so
something, I don't know.
if you're advocating for the client, you can't let them go through it just because the family wants it. You get what I mean? That would be the incorrect thing of being an advocate.
Yeah, because that one he just said like, oh, I'm doing this because this is what my family wants.
Yeah, because I think there was a
Um,
keyword, because I remember I was between that answer and mine, and I remember there was a specific wording for it where I was like, oh, it has to be this one because it implied like someone else he was doing it for someone else.
Right, and that's probably the one, yeah. That's where you're not seeing the advocacy, because again, it's not what they want. And that's what you're trying to do. You're trying to do what's in their best interest and their best wishes. Give me one quick sec.
Thank you so much.
Okay. Alrighty. So, advocacy refers to here's the formal definition, right? Advocacy refers to the nurse's role in supporting clients by ensuring that they are properly informed, that their rights are respected, and that they receive the proper level of care. Advocacy is one of the most important roles as a nurse. As an advocate, the nurse ensures the client has the information he needs to make decisions about healthcare. The nurse must act as advocates even when they disagree with the client's decision. The complex healthcare system puts clients in a vulnerable position. Nurses are clients' voice when the system is not acting in their best interest. So nursing roles in advocacy. So nurses must careful to assist them when making their decisions, mediate on the client's behalf when the actions of others are not in the client's best interest, or changes need to be made in the plan of care. Situations in which the nurse might need to advocate are end-of-life decisions, access to health care, protection of client privacy, informed consent, and substandard practice. All right, so essential components of advocacy, again, having self-confidence, caring, autonomy. So if, again, they're not acting in their best interest, when we said, right, when they're doing it for the family, it's at that point what they really want. Make sense?
Mm-hmm.
All right, informed consent. What are you there for? What's the nurse's role?
Witness.
Just to witness the signature.
Just to witness, not that they understand. You're there only to witness. Okay? So informed consent is legal process, right? So the client has been provided with these following: the reason the treatment or procedure is needed, how it will benefit them, the risks involved, other options to treat the problem, including the option to not treat it at all, okay? And the risk involved if the client chooses no treatment, okay? The nurse's role in the informed consent process is to witness the informed consent form and to ensure that the informed consent has been appropriately obtained. So processes where they're not appropriately obtained is there's a language barrier, right? So you need to get a medical trained and hired, right? Like the person to translate for them. Can't be their family member or a nurse or anything like that. It does have to be a professional interpreter. They are sedated or the medication is affecting their thought process too much, okay? These are cases where they're not able to sign their own informed consent. Okay, so signing an informed consent form. So the form for informed consent must be signed by a competent adult. Emancipated minors who are independent from their parents, such as a married minor, can provide informed consent for themselves. So there's the answer to your question. Can the married minor sign? Yes. Okay, because again, they are emancipated if they are married. Make sense? Okay. The person who signs the form must be capable of understanding the information. The person must be able to fully communicate in return with the healthcare professional. When the person, here's talking about the language barrier, a trained medical interpreter must be provided, okay? Individuals authorized to grant consent for another person, parents of a minor or a legal guardian, a court-specified representative, or somebody who has a durable power of attorney or is a healthcare proxy, okay? Spouse or closest available relative, okay? Closest available relative, so if the spouse is missing or they have no wife or husband, then it follows on to parents. If parents are not available, it's kids, okay? And the kids go from order of oldest to youngest.
What about cousin? Because it said cousin.
Yeah,
adult. Adult cousin.
If the others are minors, then yes. But if someone else is an adult and it's parents, then kids, then the cousin would not stand. But if the cousin is the only adult and the kids are still minors, then it would go to the cousin because he's the competent adult.
Oh, okay.
Does that make sense? Like, the
Yeah.
next person has to also be capable of making a decision.
Yeah.
So if they wouldn't be able to make a decision for themselves, they definitely can't make it for the parent.
I didn't think that one because I was like, it has to be the mom, the dad, the grandma.
Yeah, so it usually goes that way, but again, if they're not there, then it'll be the next adult, which follows the order of kin. So again, if the kids are small still, they're younger, they're underage, they still can't provide it.
Because I think the question said something about like, if a minor, like that needs care, who can do it? Cousin, it says, just do the emergency or something like that.
So if you,
That one was just do the procedure.
That one should
Yeah,
be the procedure?
because you're acting in their best interest.
if you can't reach the parents, you can use the grandparents. per day.
Yeah, but that wasn't one of the answers. It had cousin, that's why I said no, but I put just do the procedure.
Mhm.
Yeah? Okay.
So for provider, complete the script, right, they need to complete the prescription, give them the right to refuse, all the rights that they have. The client has to give it voluntarily, so no coercion, right? You must be competent, legal age, or emancipated minor, and receive sufficient information. The nurse is there to witness, okay? So that's for informed consent. Lastly is advanced directives, alright, and there's different, I wouldn't say different kinds, but there's like different topics on this, right? So you have your living will, durable power of attorney, okay? So living will is a legal document that expresses the client's wishes regarding medical treatment in the event the client becomes incapacitated and is facing end-of-life issues. Types of treatment that are often addressed are those of the capacity to prolong life, such as, should they have CPR, mechanical ventilation, and feeding by artificial means, okay? Living wills are legal in all states. Most state laws include provisions that healthcare providers follow the healthcare directive, okay? So a durable power of attorney is a healthcare proxy is a legal document that designates a healthcare surrogate who is an individual authorized to make healthcare decisions for the client who is unable. The person who serves in the role of the healthcare surrogate to make decisions for the client should be very familiar with the client's wishes. Living wills can be difficult to interpret, especially in the face of unexpected circumstances. A durable power of attorney for healthcare as an adjunct to a living will can be more effective in ensuring the client's decisions about healthcare are honored. Let me explain that. A living will is just a document saying what I want. Okay, or also known as your advanced directives, if you've ever seen them, right? That's why you see the orders of DNR, right? Or only CPR can be enforced, so they don't want mechanical ventilation, right? Or they could just want just a compressions. So those options are on there. That's the living will, right? Do you want CPR? Do you want mechanical ventilation? Do you want artificial means of feeding, which means a GT or feeding tube? Okay, now the healthcare proxy, they call them, or in this case, they call them durable power of attorneys for healthcare. I'm specifying somebody to make my decisions for me. And they know me, that's why they know what I want. So the doctor's gonna take your word for it because you're supposed to be so close to me, I already talked to you about what I want. So they have to listen to what you're saying. I'm unable to do so, I'm unconscious. If I've set this up, but I'm still conscious, none of that matters. I'm conscious, right? Like I'm still able to make my own decisions. I've seen questions like that. Like the point is, if I'm unconscious, that's when this kicks in. But if I'm competent to make these decisions, then that's fine. So if the person is sedated, unconscious, whatever the case may be, then that's when that kicks in. Yes?
So the question was, if the person in his living will said that they don't wanna be resuscitated, but they didn't have a DNR prescription, what would you do?
They had an advanced direct, the living will said that they didn't want to be resuscitated, but there was no official DNR in the system signed by the provider.
Oh, was signed by the doctor.
It
You
wasn't
just have to
signed
do
by
it,
a
right?
doctor, right? It
So
was
yeah.
not, so you would
have to call the code, right?
I think you have to call the code,
Yeah,
yeah.
I
You
put
need a
run a full quote on
prescription
that.
from the doctor.
Cause that's like saying there's no official order.
Yeah.
Like
Right.
anyone
Doctor
could
has
have
to
wrote
sign
that.
The doctor does have to
doctor
sign
has
the
to
DNR.
sign the
They do
DNR.
have to sign the DNR.
Yes.
Yeah.
Yeah, you need to, even though it's there, the doctor didn't sign it, so it doesn't matter, they have to do CPR.
Yeah, I'm pretty sure that the order needs to be in for the DNR.
I remember
I'm
that.
curious about
Yeah,
this.
we-
Do you have
we
your
talked
ACI
about
order?
this
Yeah,
before.
let me pull it up.
So pull up your
Oh, yeah,
results.
Huh?
I think I got that one, 'cause I was like, wait. I think that it is you have to resuscitate. If it's signed, then you do.
Wait, but there's no answers. Why am I pulling it up?
But on
I think
the
it says
focus
like the
review, you can do it.
Oh,
Did you get that one out?
I got it right.
I got that one wrong.
You got it right?
What did you put?
Well,
how do
yeah,
you,
so-
wait, how do I know
used
if
to
I
run
got it
code.
right?
Yeah, you read the
Should be
code.
advanced directives. Because when you're doing the DNR, the doctor goes more in depth on what it is.
It has to be signed.
And I go to approve, right?
Where is it?
Yeah, go to, or no, just go to your results first. Or what are you, go to your results first.
Wow, I got 100% in human force.
I think it's gonna be this one, actions during cardiac arrest probably.
Oh yeah, it was. Cause the patient was in cardiac arrest.
Yeah, it's gonna probably be that one. So let's see, if you got it right, then if you don't have it, then it's gonna be that one, like, so go to, no. Okay,
To the. I think I got the logo.
So what is it? COVID, right?
Care.
What's the percentile?
No, you don't have it.
It is actually during cardiac arrest.
Huh?
Yeah, so you got it right. It's you don't continue with it because the DNR is not there.
Yeah.
Wait, Mr. Armando, what's the
Yeah.
So wait,
percentile
what?
in?
For
So the-
cardiac arrest, 62.5 got it correct.
You would code it.
Yeah.
So
You
40%
have
of
to
people
say
got it
you
wrong.
are-
You run a full code.
Yeah.
Wait, where did you read?
I knew
Right
that
here.
one.
What?
So it shows you which ones you got wrong. So since it's not coming up on mine, I got it right.
Yeah, you see? So for mine, like professional responsibilities, cardiac arrest, 62.5 got it correct. So 40% didn't. So if in your focus
It
review
doesn't say that.
you have that, then you got it wrong. But if you don't have it, you got it right.
Oh, okay, so
Did
the
you-
answer is to call the code.
Yeah.
Call the code
Oh,
because there
that's
is no
what-
DNR order.
Yeah, but there was an order, but it wasn't signed.
Yeah.
Right, there you go. So then again, there's no order.
Got it.
I mean, as long as it's not signed, there is no order.
Yep.
Yeah. Okay? Now, again, the reason why you should have both is because, for example, and I'll use myself an example. I don't have my advanced directives, I should, but I don't, because I am picky about what I want,
Mhm.
okay? So, for example, I can say, right, that I want mechanical ventilation, so they'll check it. But let's say I only want it for a specified amount of time. Make sense?
Mm, yeah.
Can
Like-
you be specific like that? Like, can you say?
Well, that's
like-
what you would help the healthcare proxy. Or leave something in writing so that you know when you're supposed to turn it off. So I've told, like, for example, like my family, right? I'm like, you know what? If after 6 months or like even 3 months, they just agree, like you have 3 doctors agree, I'm not coming out, just let it go. Because I don't want to be there just sitting on mechanical ventilation. You just have a living body, you know what I mean? But nothing's there. Make sense?
Yeah.
So if neurologically, right, I'm not coming back, it doesn't matter. Just let me go. Because I don't know, at least I don't know, right, how much of that you're actually feeling, right? Because your mind might still be conscious. Now, to some point, they're in their brain that they're not even dreaming, but I'm like, how do you know? Like,
Very true.
you know what I mean? And the body is still reacting physiologically to it. When people are in pain, and I've worked in a subacute where like people are in pain, you know they're in pain because their heart rate goes up, their breathing goes up, their body is still reacting a lot to the pain. Make sense? So how much you're actually conscious of that? Now, doctor will swear on the machine, but you don't know. Because I ain't trying to be there lying as people are like poking and prodding me all the time, you know what I mean?
Nursing
Not
students.
able to do it all the time.
You call the call. You
Call.
call the code.
You call the code, there is no DNR order yet, it's not signed,
So you call the code.
okay? Alright, so there it goes for advanced directives, so you guys get it. The order's not in place, it doesn't matter, follow the healthcare proxy and the living will, okay? Alright. Confidentiality wasn't really big of a problem, just real quick, right? Don't leave papers lying around, shred them. Your computer needs to be locked at all times unless you're actually doing something at it. Even if you're stepping away or looking the other way, you need to lock your computer, right? Or else people can see. Don't share your password, change your password often. All clipboards must be turned upside down if you're not viewing them, right? Like just hide all the information basically.
What
I didn't-
about
that-
faxing papers or something like that?
That one you can because you're faxing it to the
Yeah.
Okay,
long-term
I
care
didn't- I
facility
didn't
is
get
going.
that one. I think
What was
that's-
But there was one that asked like they're going of change of shift report in the hallway, in a busy hallway.
Oh, yeah, yeah.
What do
yeah.
you do? And
You
it's
No,
like
you gotta go to a private center, to a private room.
yeah.
And you're supposed to tell that nurse, like, you shouldn't be.
Right, you shouldn't,
What were the
yeah.
other answers? Because I didn't pick that.
It
up.
I
was
remember
like
the-
Yeah, you
report-
can't talk in the elevator or in the hallway. You can't talk in
Yeah.
those areas. You have to
It
go to a
was like
conference
make an
room.
incident report,
Or just tell the nurses.
tell the charge nurse, or talk to that nurse that was talking.
It's talk to them. If
Yeah,
it's
talk to the
priority
nurse.
first,
Yeah.
You're gonna talk to them about it right then and there.
Yeah, just hey, don't be talking about that here, you know, or something.
Oh, yeah, I picked that one.
I had a
I did
Yeah.
that one.
question.
Yes,
So one is about
Oh.
child maltreatment reporting statutes.
yes.
Would you get a criminal offense for negligence if you didn't report? If you have failure
Oh,
to
yeah.
report?
I don't think so. Oh wait, if you fail to
Yeah,
report?
if you fail to report,
if you
it's
fail to
negligence.
report, yes,
Cause
it is a
you're
criminal,
mandated.
you
We're
are
mandated.
criminal liable, yes.
Okay.
Yeah.
If you suspect, it says suspect, right?
Yeah, but you
Yeah.
have to report.
Okay,
And-
okay.
and that's why they always make us watch that video. I just watched one guy hire someone else. You have to report, even if you just suspect. Like you have to
Okay, yeah,
report.
I picked that
Yeah,
one.
and
Because
that's
you're
why
a
it says to get a
mandated
detailed
reporter.
history.
Yeah, you're a
Yeah.
mandated reporter. So even if the suspicion is there, you have to bring it up.
But it's not your responsibility after that, like
No,
someone
no, no,
else
no.
does
Yeah,
it.
once you pass that on and the authorities know, that's it. You're out.
And they can't sue
You did
for
what
it,
you had
'cause
to
you're
do.
mandated.
Right,
Oh,
and
yeah,
yeah,
that was
they
the
can't try to do anything
What can
towards
you get
you.
sued for or something,
No,
right?
you're
Yeah.
protected. The hospital will cover you at that point too.
Yeah.
Or the facility you work for.
All your job is you have to report. So they free you from everything if you report, but they'll bring you down if you fail to report.
So even if it's wrong, like it was actually like the
Right.
kid got hurt outside.
Hey, yeah, like, oh yeah, the child actually did fall. They're not beating them, right? Like,
Uh-huh.
all right, well then
Yeah.
it is what it is.
Okay.
But you know what I mean? But even if you fail to report it, then you're gonna be in real trouble.
Got it.
And my
Yeah.
second question was, like, procedures where you would do informed consent. Like, I know it's invasive procedures.
So
I think
here's
it
the
was
thing.
that vein one.
The catheter,
venous-
wasn't it?
No, it wasn't the catheter, it was that
Venous.
venous one, that venous one you have to get, right?
Yeah, so let me explain this. That's a good question actually, and we'll touch on this. When do you need informed consent?
Okay.
Yeah.
Invasive procedures is a very good way to just know it. But we do some things that are slightly invasive, but I'll put it to you this way. If you can do it as a nurse, it does not require informed consent.
Oh.
So that one was the central venous catheter.
Make
That
sense?
was the-
That one.
Catheters, punctures, NG tubes, right? That does not require it because you can do it. Because remember, informed consent is that you witness doctor signs. That means the doctor is doing it. If you're doing it, how are you doing informed consent? So who else is going to do your informed? You're a nurse. Make sense?
Got
It doesn't comply.
Got it.
Anything that you can do as a
No,
nurse,
it's central
I picked
line,
NG
because it's
tube
right
too.
here.
no. Anything that can require that you can do as a nurse does not require informed consent.
Got it, that's
Okay.
easier to.
You got me?
That is a lot easier.
Yes. Now, I used to say, right, if it's not invasive, like it doesn't poke a hole in them, but that's not true either because we do IV lines, right? Or not us, but nurses do IV lines. You do NGs, you do this, and then I used to sometimes say, if the hole is not there, then you can't do it, right? But then again, there's like laparoscopies or bronchoscopies. They do require informed consent, and they're going through the mouth already.
Yeah.
So I phrase it to just the simple term of, if you can do it as a nurse, it does not require informed consent. Only if a doctor is performing these procedures, which yes, like the angiographies, right, where they're seeing their veins, right, they're injecting a dye.
Mhm.
All of these things require informed consent
Okay.
because there's a danger to the procedure.
I have one more question.
Yes. Yes.
What type of cases do you report to the case manager?
Were there answers for it?
Oh, the
Yeah.
case
Like, it was
manager
like
one?
referrals to case manager.
It was like a
Oh.
patient with newly,
Oh, diabetes.
Diabetes.
Yeah, DM type 2.
cause it would be, I put that one because it's new. The
Yeah.
rest were like they've already had that diagnosis.
Yeah, I would think new diagnosis
one?
or if they need like social
Mhm.
work help. Yes, because the case manager is gonna basically help them outline a plan.
Yeah.
So any new cases, if they need social work help, right, like they're homeless or you know they need like food assistance, anything that requires something outside of our like care as well, that happens. Or if they need a plan of care for them now. So that's why new diseases, or if they have a current disease but they want to change their treatment as well or like their plan, you can refer them to a case manager as they help them establish the plan.
So like if they get out of the hospital to a long-term facility, then they need a case.
They should need a case manager to plan their care with them.
That was
Yeah.
the one, that's the one I picked, yeah.
Yeah. So that's for.
It said going from acute to long care or something like that.
Yeah, I would
That's what I
pick that
picked.
one as well.
Or something like that.
Okay.
Yeah.
So that one,
Confidentiality. Oh, again, use of social media. Really, let's try to go in order here. Use of social media again. You can't be with them on social media, right? Everybody knows that. Can't. You gotta just professionally tell them no. All right, and then we were talking a little bit about this negligence and malpractice. Okay, negligence. The way that I can phrase this to you is just basically negligence is you failed to do something that caused the harm, and in malpractice, you did do something that was a mistake that caused the harm.
Like
So-
double dose or.
like, yeah, like
somebody
you
else
overdosed
brought
them, right, you
medication.
gave too much medication, or you applied the restraints incorrectly, right, because you're doing something that's causing harm. Now negligence is you fail to do something, so you fail to check on them, for their restraints, right, you know, you're supposed to go every 2 hours, you fail to do that, and that led to their wrist or something becoming, you know, hurt, or skin breakdown. Or you didn't, put your fall precautions, right? Or you didn't put on their slip resistant shoes, like, you're failing to do the actions that would prevent the harm. And in malpractice, you're doing what's causing the harm, okay?
Yeah, I think that's all my questions.
Okay, so those are those. Now, let's go over these. So those are called what kind of torts? Negligence and malpractice.
Civil?
They are, like, it is kind of like civil, but they're called torts. There's unintentional, quasi-unintentional, and intentional. They are unintentional torts.
Unintentional torts.
Now, quasi-intentional torts are like defamation, and there's two of them, right? Where you're talking smack basically about somebody. Now, there's libel and there's slander.
What's the word that you just said?
Defamation, and then they have two types, libel and slander.
And was, liberal, when you do it under documentation?
Written, so you can just say written, right? Libel is that you are, like, for example, posting flyers, like, you suck, like, you don't know what you're doing, right? Like, or whatever. You're making fun of this person through written communication, whether it's flyers, posts, bulletins, whatever, right? Like, yeah, right? Photographs, so written, or you could say, right, or visual defamation, that's libel. Slander is when you're saying it, right? So this person is an unethical nurse, you know, doesn't know what she's doing, like blah blah, like you're talking something that's not true and you're slandering their name. So slander is talk, libel is written, or you can say visual. And then there's the intentional torts. Assault, battery, and false imprisonment. And assault and battery is what I used to get confused, right? Because I think assault is the one where you like hit somebody or somebody.
Assault's always verbal, battery's always
Assault
physical.
can even be verbal. So the conduct is described as the conduct of one person makes another person fearful and apprehensive. Threatening to place a nasal gastric tube in for a client who's refusing to eat is an example of this. You didn't actually do anything to them, but you are assaulting them because you're threatening them.
I think that was the question.
Yeah.
That was,
Like, that was word for word the question.
Yeah.
Like, if you don't go to the bathroom, we'll put a catheter in.
Yeah.
Yeah, things like that, yeah. So you're threatening them. You're not actually doing anything, but that is assault already. You're making them fearful, right? If you're striking fear or apprehension, right, which is just similar to fear, like then you're committing assault. Now, battery is when you physically touch somebody that did not consent to you putting your hands on them. Okay? So battery, intentional and wrongful physical contact with a person that involves injury or offensive contact, such as restraining a client and administering an injection against his wishes. Alright? False imprisonment, a person is confined or restrained against his will using restraints on a competent client to prevent his leaving the healthcare facility. Right? Or you can't leave until this blah blah blah. That's false imprisonment. They can leave anytime they want. Makes sense? They just gotta sign an AMA.
yep.
They can leave anytime they want. Okay? It's all about wording. Right? Because we hear that all the time. You can't go home until we do this, right? It's bullshit, you can't. The thing is, we don't want to let you go home until we do this, right? Like, you know, it's better if you just receive this treatment. So just, wording is everything, you know. It's best if you do this or else, you know, you can become worse. Alright. Ethical principles. I didn't see too much of this on there, but let's cover them real quick. So ethical principles. You guys know, right? Autonomy, beneficence, fidelity, justice, non-maleficence, and veracity. So let's run through them. Autonomy, that you
encourage the patient.
Can
Yeah, that
do what
you
you
are
want.
the one making the decisions. By you, I mean the patient, so they themselves are making their own decisions. That's autonomy. You're respecting their decisions.
Mhm.
Right, you wanna respect, so the word is, you wanna respect the client's autonomy, and his autonomy is the right to make his own decisions. That's their autonomy. Beneficence, that you're gonna do care and only do good towards them. Fidelity, that you are keeping basically like your trust to them, right, that you're being loyal. Okay, you're doing what you're saying you're gonna do. I'll be back in 10 minutes, right, and you come back in 10 minutes. Justice, fair treatment, right, at all costs. Non-maleficence, you won't do anything that you know is gonna bring harm to them. And then veracity, you're being truthful about each and everything that you're doing.
So the one on there was like, you're gonna give the patient, I think it was heparin, and you make sure that a second nurse witnesses it. Is that veracity?
It was veracity.
I put
Right?
veracity.
I did put veracity.
Cause that's what I put. Cause you're
thought
making
non-maleficence.
sure that
Yeah,
it's
non-
correct, right?
Oh, I see what you, so the question was, the question is asking.
What is that displaying? By making sure that a second
Oh.
nurse is witnessing your
It's, yeah, the question
heparin
kind of
thing.
said something like,
Like you're giving heparin and you're asking another nurse to make sure
No,
that
it
you're.
says like, what are these called?
The second witness thing,
Yeah,
cause it's like.
so which ethical principle is being
Yeah, ethical
displayed?
principle, and then it gave that example.
You're loading your heparin and you ask another nurse
Yeah.
It's
to
not
look at it.
No, it says you
No.
don't have another nurse looking at it, right?
Oh, you,
No, I think
the question, the answer were, you asked a nurse to look at what you're
Yeah.
doing.
so
Oh.
so did it describe the ethical principle?
It,
No.
No.
It gave you 4 choices.
It just
Okay.
gave you the ethical principles and said, by making sure that a second nurse is witnessing the heparin
yeah.
administration, what ethical principle is
I
that?
It
put
was
veracity.
non-maleficence, cause I didn't get it wrong. It's not.
I think it would be, yeah, it's not veracity. Veracity is that you're saying the truth.
Mm.
But, well, isn't that the truth? Like you're
It is the
mentioning
truth, but it's
But
more
you're
non.
doing something to not harm the client though.
Yeah.
Well,
I
that
think
was.
that
It's not,
Yeah,
it's not,
but-
no, it's not
No.
veracity. Veracity is straightforward, like the nurse's duty to tell the truth. You're not telling the truth by making another nurse watch you.
Yeah, I got it
You're
wrong.
telling
I
the
put
truth by
veracity.
telling
So
it.
this is, then it's no harm.
And more than likely it's non-maleficence or beneficence if it was on there.
How
Oh,
do you-
beneficence was on
Yeah.
there.
Cause the question was really short, it was literally like,
It did.
word
Yeah.
for word,
It
it was
did
just
have
that.
I would say it's beneficence more than anything.
Okay, what is beneficence again?
Again, so here the definition is care that is in the best interest of the client, which double checking a dose is that. Make sense?
Okay.
Veracity is like actually literally speaking the truth. I am only giving you 5 milligrams of this, and
Or
if that's
like
true, that's veracity. You're telling them the truth. You're
You
telling.
have cancer, you're,
Right.
or whatever. That's-
But it applies more to like, I mean, it could be in that case, but again, it's you're physically speaking. That's veracity.
Well, the
Does that make sense?
was on there.
Yeah, I would say just it's more beneficence or non-maleficence.
How
Well,
would
then
you
he put-
differentiate
You put something else and he says his wasn't on there.
non-maleficence?
You put non-maleficence and.
I could see that. Because it's you're avoiding to bring harm to the client, right? You're trying your best to not bring harm to the client.
How would you
Yeah.
differentiate between beneficence and justice?
And justice, beneficence is like, let's say you are doing the treatments, right? Like you're applying the treatments. Now, justice is that you're doing the treatment the right for everybody. So imagine that I do her dressings for her leg or whatever. I do it loose and I didn't even care what I did. As opposed to here, I apply all like correctly how it is. I make sure that it is tight, that it is.
Equal care for everybody.
Yeah, that it's equal care.
Okay.
Right? Or I'm like, oh, this person, you know, it applies also more to just ethnicity as well, where people have differentiate on ethnicity or gender or nationality, right, or anything like that. So then they provide different levels of care for that. Justice is especially hard. So there's that. That one's easy, right? You're like, oh, I'm not racist, right? Or I'm not this. But what about when you have someone that you don't agree with? And I'll give you a clear example. One of the most common use examples. Like, I mean, well, that's the gender orientation. Again, so people are like, I'm not sexist, I'm not this. But what about a rapist? Anyway, stay quiet. You see what I mean? You see what I mean? You see what I mean? So there it
Well, you
goes.
have to
I mean,
give
you
You
them
still
have to
have to-
treat them the same.
Yeah, you still have to act on their best care
Yeah,
regardless.
exactly, and that's hard because you know what he just tried to do or what he did do.
Yeah, but at the end of the day, like, we're there to do a job. Doesn't matter what
Exactly,
they are.
and that's where it's hard. That's where you have to question yourself. Huh?
Knows, like the doctor knows what they did, but you still have to like
Right.
do it even though you're.
Right, so that's a commonly used example.
Well, wouldn't that be the same thing too, like people who are like, the girl wants to have an abortion and they're against it or whatever, you know what I
Right.
mean?
So that's the same thing. Again, it's justice.
That
You have
would
to
be
you have to
justice.
do what you need to do, and everybody's to the same to everybody.
Okay, yeah.
So no matter if what who or what the patient wants or does, if it falls in your scope, then
You have to.
you have to treat it the same. You can't differentiate. Make sense?
Mhm.
That's justice. That's where it mostly kicks in for like, where obviously you don't want to give fair treatment and you have to. Yeah. So that's more of a question for justice. Also, just it could be like even use of like not even to people, but just like use of resources. For example, like you only have X amount of like saline water or like alcohol, right? You gotta divide it evenly, right? You're being fair to all your patients. Does that make sense? Like you're not, oh well, these I like, so I'm gonna give them more of this, and I won't have to use alcohol on the rest of them or whatever. You're distributing resources evenly. That's another way as well. Okay. All right. We said somebody asked me in the bathroom.
In the bath?
At the bathroom, they were asking me about who do you black tag?
That sucks.
I know.
Oh, yeah.
By the way, I think